Hi, my name is Seema Zarini. I am from the nursing department of Los Angeles Valley College. I am a fourth semester nursing student at my pediatric rotation.
Hi, my name is Dina Gullian. I'm a fourth semester nursing student at Los Angeles Valley College, currently attending the pediatrics rotation. So because ELC at CDI was close to families, we were suggested to make a presentation for CDI staff members about the importance of personal protective equipment and the importance of getting COVID-19 vaccinations.
What is COVID-19? COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people will experience mild to moderate respiratory illness and recover without even any special treatment. However, older people and those with medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. Especially people in their 60s or 70s are at higher risk than people in their 50s. How does COVID-19 spread? COVID-19 spreads mainly through close contact from person to person, including between people who are physically near each other, within about 6 feet. They can get exposed to respiratory droplets through talking, coughing, and sneezing. Respiratory droplets cause infections when they are inhaled or deposited on mucous membranes, such as those that line inside of the nose and mouth. As the respiratory droplets travel further from the person with COVID-19, the concentration of these droplets decrease. Example of respiratory droplets are pneumonia, flu, and the common cold. Also, COVID-19 can be spread as airborne transmission. This kind of spread are like tuberculosis, measles, and chickenpox. Airborne transmission is different from droplet transmission, as it refers to the presence of microbes in the droplet which can remain in the air for long periods of time. This virus can be transmitted by touching contaminated surfaces. How to protect yourself and others. Important ways to slow the spread. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in public places, or after blowing your nose, coughing, or sneezing before eating food, touching your face, or using the restroom. If soap and water are not readily available, use hand sanitizer containing at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Wear a mask. Other important ways to slow the spread of this virus is wearing a mask and practicing correct donning and doffing of PPE. Everyone 2 and older should wear a mask in public. Types of masks. The type of mask used for droplet precautions is a surgical mask, which CDI staff uses at CDI clinic. This type of mask protects you only against droplet transmissions. However, since COVID-19 is also an airborne transmitted virus, the type of mask used for this precaution is N95 respirator, which is used at hospitals. Usually, N95 respirators are provided by individual fitting. CDI Clinic carries this type of masks as well, and you are welcome to use it. So, the main difference between these two types of protection is the size of droplet and airborne particles. Droplet is greater than 5 microns and airborne is smaller than 5 microns. You can visualize in the picture how small the virus size is, which is too small to be seen with the naked eye. Donning and doffing of PPE sequence. A sequence for donning PPE. First, wash your hands. Then, don the gown, followed by a mask or respirator, depending on what you need. Then goggles or face shield, and lastly, the gloves. A sequence for doffing PPE. Doff the gloves first, followed by the gown, then the face shield or goggles, and lastly, doff the mask or respirator, and wash your hands.
Okay, now let's talk about other ways to protect yourself and others. This one is about keeping distance. So, what we need to do, avoid close contact with people who are sick. If possible, maintain 6 feet away. Remember that some people without symptoms may be able to spread the virus. Also, we need to avoid crowds. Being in crowds like in restaurants, bars, fitness centers, or movie theaters put us at higher risk for COVID-19. Also, we should try to avoid poorly ventilated spaces and bring in fresh air by opening windows and doors if possible. Okay, let's talk about COVID-19 vaccination, about its protection, benefits, and immunity. We all need to get vaccinated to protect ourselves and others against this virus, especially people with underlying medical conditions such as COPD, hypertension, diabetes, and other chronic diseases. All vaccines currently available in the United States have been shown to be highly effective, and their known and potential benefits outweigh the known and potential risks. It may help us from getting seriously ill even if we get the virus, because it forms some natural protection known as immunity. You get the vaccine, and your body starts acquiring antibody response to attack the virus cells. Some more things to know about COVID-19 vaccine, about the safety, dose, side effects, and cost. The safety of COVID-19 vaccines is a top priority. The US vaccine safety system ensures that all vaccines are as safe as possible. Depending on the specific vaccine you get, a second shot 3 to 4 weeks after your first shot may be needed. You may experience side effects like fever, chills, fatigue, shoulder soreness, but this is a normal sign that your body is building protection. It may feel like flu and might even affect your ability to do daily activities, but they should go away within 24 hours. Vaccine doses in our country are provided to people at no cost. So our main message from this presentation is that the combination of getting vaccinated and following CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. Stopping a pandemic requires using all the tools we have available. In other words, it is all in our hands. It just depends on all of us to take necessary and appropriate actions. Thank you for your attention.